Okay, my verbal documentation for my complete physical assessment. I had a 39-year-old female who was awake, alert, oriented times 3. A good nutritional status. She was clean and well groomed. A good balanced diet. She had good posture and position, rhythmic, straight, upright. She walked without any assistance. No deformities noted. She had a pleasant mood and affect, no anxiety that was notable. She made good eye contact. Her speech was spoken with ease and was very organized. She didn't have any problems with that. Her skin was warm, dry, and pink, and her turgor was non-tinting. Her cap refill was less than 3 seconds. Both peripheral pulses were palpable, the radial and the brachial. And for her head and face, her scalp was without lesions. Her hair had no dandruff and it was easily distributed, and there was no pain or tenderness on palpation. Her cranial nerve, everything was symmetric on the cranial nerve 7 for her face. The temporal artery was palpable and there was no tenderness. Cranial nerve 5, there was no limitations or pain. The maxillary sinuses and the frontal sinuses, there were no pain when palpated. For her neck was symmetrical, no lumps or pulsations. Her lymph nodes, there were no enlargements or pain. The carotid artery was palpable and it had equal weight, rate, and rhythm with no turbulent sounds. And for range of motion and her muscle strength was full range of motion and strong strength. Okay, and her eyes, for the cardinal fields of gaze, cranial nerve 3, 4, and 6 was equal and steady eye movement, no nystagmus noted. At the external eye, the eyes and the eyelids were equal distance apart and they're symmetrical. They weren't protruding or sunken. Conjunctiva was moist and clear, and her sclera, cornea, and irises. The sclera was white, the irises were the same color on both sides, round, and there were no irregularities noted. And the pupils were perla, equal round, reactive to light accommodation. Ears on the outside, there was no dryness or redness noted, no pain or tenderness. Hearing, the cranial nerve 8 with a Weber and Rhines test, and there were no irregularities there, and hearing was equal on both sides. For her nose, there were no lesions or redness like swelling. Everything was symmetrical. The smell test, cranial nerve 1, she passed it. Her nose was patent and the mucosa was pink and moist. The septum was midline, straight, and intact. And her lips and mucosa was smooth, pink, moist, no lesions. The teeth and gums, she had no dentures, loose teeth, there was no pain, no lesions on the gums. And her tongue and the palate was smooth and free from lumps or nodules. The tonsils were non-swollen and intact. The uvula and cranial nerve 9 and 10. The palate raised and the uvula remained midline. Gag reflex was present. Cranial nerve 12. No atrophy, tremors, and a strong strength of the tongue. And the thyroid gland, no enlargement or masses on palpation. Okay, posterior thorax had even scapula and vertebrae was midline and symmetrical chest movements, and there was no pain or tenderness or masses noted. And on percussion over her lung fields, there was no pain and renaissance was heard. And percussion of the kidney, there was no pain or tenderness noted. Breath sounds were clear and even, no fluids, mucus, crackles, wheezing, or stridor noted. On the anterior thorax, also no masses, and it was symmetrical movement. Her breath sounds were clear, even, unlabored, and her trachea was midline. On the heart sounds were heard sitting. There were no murmurs or gallops heard. The apical pulse was fourth intercostal space, midclavicular line. And for the abdomen was soft, flat, non-distended, symmetrical. The umbilicus was midline. There were no masses, nodules, or pulsations noted. And the bowel sounds were active in all 4 quadrants. And the vascular sounds of the abdomen, there were no bruits or hums heard. On percussion was tympany. And on light and deep palpation, there was no guarding, pain, masses, or obstructions noted. On the extremities, the lower extremities were symmetrical, and the skin was warm, dry, and pink, and the hair was evenly distributed. The pulses of femoral, popliteal, posterior tibial, and dorsal pedis were all palpable, and there was full range of motion and strong strength in upper and lower extremities bilaterally. And the Hildesheim test was performed without any problems. The patellar reflexes were non-hyperactive or hypoactive, and the scoliosis cream was no indication of any problems. Everything was midline.